Pakistan, with a population of more than 140 million and growth rate of 2.1%, stands amongst the most populous countries of the world. After 56 years of independence, 60 million Pakistanis do not have access to health facilities. Some 67 million people are without safe drinking water, and 89 million are deprived of basic sanitation. Around 700,000 children die every year, half of them as a result of malnutrition, whereas maternal mortality stands at 340 per 100,000 live births. The literacy rate in Pakistan is 44%. Two-thirds of the total adult population and 77% adult women population are illiterate. School enrollment stands at only 45%, and half of primary school children drop out before reaching grade 5. A low human development level and proliferating demographic pressures are locked together into a fatal, unending embrace. The dismal state of the social sector in Pakistan can be attributed to inconsistency of policy, paucity of resources, and inadequate budgetary allocations for social development. HANDS is a non-profit registered development-oriented organization. HANDS is working for the last 25 years with community organizations with strong commitment to develop the underprivileged communities in Pakistan. HANDS is benefiting more than 2 million poor of nearly 5,000 villages in 2004 through primary health care, literacy and primary education and poverty alleviation programs. HANDS is operating in 5 districts of Sindh province directly. Additionally, it is benefiting nearly 11 districts of Sindh through its training programs. HANDS head office at Karachi is the hub of all its activities. Regional office in Bin Qasim town operates in rural Karachi. Regional office Hyderabad and sub-office Hala cover the area of district Hyderabad and Sangar. Similarly, regional offices in Thatta and Badin are operational in their respective districts. HANDS regional offices in these districts are not only resource centers for different non-profit and private organizations, but also perform as facilitators for different departments of the district government. The founder and the present chairman, Professor A.G. Billu, along with a highly committed team of volunteers, that is the executive committee, leads the entire program. They are well supported by nearly 200 full-time and nearly 600 community-based part-time employees. In addition to this, more than 25,000 grassroots volunteers support the professionals. They are the backbone of HANDS and mostly comprise of well-aware women. HANDS mission: provision of basic health services, primary education, and income generation opportunities through development of institutions to empower the underprivileged communities. HANDS integrated model intervenes in the health, education, and poverty status of the community with the collaboration of community organizations and developing public-private partnership. This leads to development of the model communities. HANDS starts its development activities in a village by assessing the needs of population through scientific methods of research. HANDS approach emphasizes on community participation, development of local leadership, and self-reliance for all public and private initiatives. The process is divided into many steps, and each step is a complete process in itself. In the second step, a meeting with community leaders and groups of people is arranged who play a pivotal role in the initiation of the program. The role, responsibilities, and share of the two partners is then discussed. HANDS share is to provide mostly technical support and advisory services and to some extent logistics. Most of the logistic, including premises for school or health centers, volunteers and monitoring, in turn become the responsibility of the community, and eventually lead to a sustainable program. HANDS forms and strengthens a community organization of both men and women, which is the most important component towards self-reliance. They pass through a process of trainings and continuous engagements for nearly 1.5 years. Each organization spends 4 days in a quarter in these formal trainings, and then HANDS field staff follows them for village-based activities. The process leads to a well-established, empowered organization which possesses the competency required to run or monitor any public or private project. HANDS has strengthened in recent years nearly 550 community organizations. Half of these are women organizations. They are equal partners in serving nearly 5,000 villages. In the next step, HANDS usually conducts baseline surveys with the assistance of these trained volunteers. This is compiled and analyzed to measure the basic socio-economic and demographic indicators to see a comparable picture before and after the period of 3 to 5 years. During the process of strengthening of the men and women community organizations, the program selection takes place on the basis of needs assessment. If there is no or partially functional health facility, HANDS offers to poor community the package of integrated health program. The process initiated with briefing of the program in large community meeting. Then a process of selection of a girl and a boy of the village as community midwife and community health attendant takes place for 1 year diploma training. They also work hard in establishment of their own community health center with their own contributions. HANDS initially supports community organizations in logistics to equip the center that includes furniture, medical equipment, and initial lots of supplies and medicines. HANDS has developed a unique training curriculum, training methodology, and training plan for midwife and health attendants. They get 6 months hospital-based training, and for next 6 months they spend 15 days at their own newly established village-based health care and 15 days in classroom in a month. We have established community midwifery health attendant training schools in 2 government hospitals, Government Taluka Hospital Hala 50 bedded and City District Government Hospital 20 bedded Bin Qasim Town, Karachi, after signing an agreement with the 2 authorities. These training centers train nearly 40 midwives and health attendants each year. During training, HANDS bears lodging, boarding and traveling expenses of these trainees and provides them stipend. As soon as midwife and health attendant get trained, they are placed back to their villages and initiate service delivery in the average population of 3 to 5,000. The collaboration is an excellent model of public-private partnership and is providing 24-hour health services to ailing communities. HANDS takes opportunity to strengthen these government hospitals. These hospitals are also the hands-on training venue for midwives and health attendants. Midwives and health attendants are trained in these hospitals. The hospitals are fully equipped with modern tools and techniques. The hospitals provide secondary healthcare services to the people of rural areas and are the best source of practical training. The hospitals provide hands-on practices to the trainees in Emergency Obstetric Care Unit, which includes labor room, operation theatre, laboratory, blood bank, ultrasound, and essential medicines. The training is conducted under supervision of qualified doctors and trained paramedical staff. Healthcare services available on these health centers are immunization for women and children, oral rehydration therapy, and control of diarrhea diseases, nutrition counseling, growth monitoring, treatment of minor illnesses, antenatal, postnatal, delivery services, and establishment of a scientific health management information system so as to make the community organization and HANDS team well aware of the disease pattern in the communities. The beneficiary population of the health program clearly shows improved health status with antenatal coverage of women nearly 75%, and immunization of women and children 80%. Most of the women are getting delivered through these trained healthcare providers, which has made remarkable reduction in maternal mortality. Considering the very poor literacy status of rural communities, HANS Education and Literacy Promotion Program intervenes to improve the education and literacy status. HANS has extensive experience of working in formal and non-formal education, both in private and public sectors. HANS is benefiting nearly 47,000 students by intervening in more than 500 primary schools in these districts. HANS is playing a role of facilitators in all the focused areas as lead NGO. HANS, in collaboration with District Government Hyderabad and Thatta, has chalked out a comprehensive district education improvement plan. HANS has made hundreds of public sector schools fully operational in the remotest of areas of these districts. HANS' approach in school nutrition package for girls is a safety net intervention for malnourished girls in Pakistan's high poverty districts. The project provides an opportunity to intervene both in education, health sector, and indirectly on poverty alleviation. HANS' goal in this approach is to improve the social and developmental status of primary school-age girls of 5 to 12 years of age. The project steps focus to facilitation, formation of school committees, which comprise of all women. Then staff provides training to 2 teachers in each school. HANS facilitates in opening of accounts for committee, so that funds for food can be flowed from federal government to district government and then to school committee. HANS field teams facilitate and monitor the whole process. Due to this intervention, many non-functional schools have been made functional. Teachers' punctuality has improved in all the schools, and the health and hygiene practices improved at school and household levels. The enrollment has increased many folds. Dropout rate decreased by 30%, and community has mobilized for local ownership and sustainability of the school and nutrition program. HANS fellowship model is for the population where no governmental facilities are available and the community is keen to run their own school. The fellowship program has 4 main areas around which the entire program has skillfully been entwined and implemented to strengthen these major pillars, that is, quality education, parents' participation, school management, and financial management. HANS dedicated field teams, after identification and negotiation with communities, facilitate the formation of parents' education committees, identifies the place usually donated by the community. It is HANS mobilization skill that many feudal lords are convinced not only to establish the schools, but also to donate portion of their houses, that is, the sitting area or otag. Later, HANS recruits local teachers, trains them, and facilitates parents' committees to develop the policies. HANS facilitated the flow of funds from donors to develop the endowment of nearly 400,000 each of these schools. This has developed by provision of subsidy for schools, which is on facility and material cost, enrollment, and attendance bonus. After 4 years, the Parents Committee is empowered enough to take over the schools, so that HANS requires minimal technical support.